When you have so many people telling you there's nothing wrong with you, you start to feel crazy.
She said it was like someone driving a spike into her head with a hammer.
My fear was that it would be something that would wind up killing her.
I'm usually strong enough to make it through anything, but my body felt like it had been through a war.
She was deteriorating so rapidly, you don't know what to do.
My greatest fear is that I was going to say goodbye to my friend.
Next, two medical mysteries that defied the experts. Amanda Kover could never have prepared herself for the onslaught of agonizing pain that would leave her unable to walk, let alone take care of her children. And after every doctor dismisses her crippling symptoms, she begins to question just how much more she can take.
I felt like if I have to live the rest of my life like this, I don't know that this is the way I want to live.
Then Ann Hummel, a seemingly healthy 36-year-old, is shaken by a series of headaches that leave her totally incapacitated. And it isn't long before Ann and her family begin to fear the worst.
I knew that I was really sick, and I thought for sure I was gonna die.
When illness strikes, we look to doctors to give us answers. But what if they can't? For these unlucky patients, diagnosis is a mystery. In the winter of 2002, 26-year-old Amanda Kover was a healthy and very happy newlywed living with her husband and 3-year-old daughter in Houston, Texas. She was extremely busy that holiday season, setting up their new house and working full-time as a bookkeeper.
I remember just feeling really excited, really full of life. We were perfectly happy. I felt great.
She had just bought a home and worked at fixing the yard up and did a lot of planting.
Then, in January 2003, Amanda and her husband Ira decide to try for a second child. But their plans hit a devastating roadblock when Amanda loses back-to-back pregnancies.
She would have a pregnancy that would begin, and then 6 to 8 weeks into it, she would miscarry and we would lose the baby.
The first time it happened, it's not that uncommon, and I didn't think anything of it, and then it happened again.
It was always, very sad. I tried to be as supportive as I could for Amanda.
On the heels of 2 miscarriages, Amanda decides that it's time to check in with a reproductive endocrinologist. After performing a thorough exam, he's confident that she's suffering from polycystic ovary syndrome, a common condition that can cause infertility. He assures Amanda that it doesn't mean she can't have another child, but getting pregnant will be tricky.
He felt that I just wasn't ovulating well. He put me on several medications to help the ovulation increase.
Amanda diligently takes the medications and prays that they'll work. Then, just 4 months after starting the regimen, the doctor has some good news.
We got pregnant and it stuck, and so we were very excited.
Overjoyed, Amanda and Ira begin preparing for a new baby. And in May 2004, Marissa Kover is born.
She was wonderful and a beautiful, healthy baby.
But as the family adjusts to having a newborn in the house again, Amanda is finding it far more difficult to recover from the birth than she expected.
Everybody's tired when they have a baby, but I felt worse than I did with my first daughter. I was extra tired. I was having really bad headaches, and I didn't understand why that wasn't going away.
She just seemed to get weaker and not have the energy to deal with taking care of the 2 children.
When I went to see my OBGYN for my checkup, he said, oh, it's just you have 2 kids now, and so you're just feeling tired, but you'll feel better, so don't worry about it.
Hoping that the doctor is right, Amanda makes an effort to get more sleep and begins taking various over-the-counter medications to dull the pain. But 3 weeks later, the headaches only seem to be intensifying.
It was mainly the top of my head here on either side, and it would never go away.
She said it was like someone driving a spike into her head with a hammer.
The pain is so persistent that it soon becomes a struggle just to get out of bed in the morning. Then, 3 months after giving birth to Marissa, a bizarre new symptom emerges.
I noticed that I have these scaly, dark patches of skin on my cheeks. When I put my foundation on, you could see a dark area where that area of skin was drier than the rest.
Even more strange, her family begins noticing other dramatic changes in her appearance.
One of the first things that actually attracted me to Amanda was her beautiful hair, and it was very dry and brittle. and didn't look like her hair used to look at all.
It became frizzier and frizzier, and I just ended up just pulling my hair back and wearing a ponytail every day.
But just when she thinks it can't get any worse, Amanda begins experiencing a new and extremely agonizing symptom.
She just started really complaining about how terrible her knees were hurting. That just kind of came out of the blue.
Amanda tries a series of home remedies hoping to alleviate the excruciating pain, but none of them seem to work.
I was popping over-the-counter pain medicine. I would sit in hot baths to try to see if the hot water would somehow help, and I would put anti-arthritic creams on my legs. Nothing helped.
The constellation of mysterious symptoms eventually becomes so bad that Amanda is forced to quit her job.
She went from being a mother that worked full-time to being a mother that was completely exhausted. It just seemed like she went downhill pretty quickly.
It hurt so much all the time that I just felt like I couldn't move. Every day of my life, I was in pain.
Alarmed, Amanda's family insists that she visit her primary care doctor.
He said, oh, well, maybe you're experiencing a little bit of depression. It's very common at the 6-month point after having a baby to experience postpartum depression, and I think you're taking a nosedive into that. I told him, I'm like, well, other than being depressed over the fact that I'm feeling so poorly, I don't feel like I'm a depressed person. And I felt very alone, and I felt very misguided.
He gave Amanda some antidepressants, basically just to kind of push through it.
I did take the medicine because I didn't want to discount what he said. He was my doctor.
Amanda continues to take the antidepressants, but after 8 weeks, she still isn't feeling any better. Tormented physically and emotionally, she's beginning to feel like she's reached the end of her rope.
I would watch my children play and wish that I could be there playing with them. I would just lay there and feel so miserable that I couldn't do anything.
Ever since giving birth to her daughter 1 year ago, 27-year-old Amanda Kover has been struggling to live with a bizarre constellation of symptoms. Strange patches of dry skin, drastic changes in the texture of her hair, and even worse, debilitating headaches and knee pain that are so bad she's had to quit her job. Recently diagnosed by her primary care physician with postpartum depression, she starts taking antidepressants, hoping that she'll begin to feel like her old self.
I supported her in her decision to follow the doctor's advice, but I really didn't think that was going to do anything to help her.
Ira Kover, Amanda's husband, is so worried about his wife's fragile condition that he sets up a series of appointments with an ear, nose, and throat specialist and a neurologist to get second opinions. But both doctors assure them that there's nothing physically wrong with her.
It was heartbreaking. The person who I loved and who I know is such a wonderful person couldn't do the most basic things that she wanted to do to enjoy her life. And I felt like I had let her down because I couldn't fix it.
After taking the antidepressants for 6 months, Amanda still isn't seeing any improvement. Completely frustrated, she checks in with her primary care doctor once again.
I went back to my doctor and I said, look, I'm not taking this pill anymore. This has not helped me at all. I need you to find out what's wrong with me. And he said, if that didn't help, then I think you have fibromyalgia.
Fibromyalgia is a chronic condition typically characterized by extreme muscular pain, fatigue, and depression that afflicts women more than men. Because there is not one specific way to test for it, the diagnosis is sometimes a catch-all for a variety of disorders.
I think that my doctor was getting tired of hearing me nag him about what was wrong with me. And I think that that's why he chose to label it as the fibromyalgia. He's like, you fit the perfect age for it, childbearing years. There's nothing to be done. There are a few fibromyalgia pain centers that are popping up. You can, investigate one of those if you like, but I'm telling you that that's what it is, and you might as well learn to live with it.
Amanda can't bear the thought of having to live with this pain for the rest of her life and is not ready to accept that she may have fibromyalgia. At this point, of all her symptoms, the knee pain is the most excruciating. She decides to take matters into her own hands and visits an orthopedist to get a second opinion.
I had knee x-rays done. I had a full back MRI. And when I went in to see the doctor to give me my results, I was very shocked when he said to me that everything looked great, everything looked fine. When you have so many people telling you there's nothing wrong with you, you start to feel crazy.
Dismissed by yet another doctor, Amanda and Ira simply can't understand why no one is taking her pain seriously.
With each successive doctor, we would have more and more documentation of the tests that had been done. And each doctor, I think, was intimidated by it and would look at it and say, I can't solve this problem. I don't see anything wrong with you.
But Amanda and Ira refuse to back down. They begin scheduling appointments with a new round of specialists, including a rheumatologist and an endocrinologist. And yet again, all of the tests they run come back normal.
I was just so tired of everyone saying, learn to live with it, you're getting older. I just wanted to know what was wrong. I was in constant pain. My head wouldn't stop hurting. I felt like, if I have to live the rest of my life like this, I don't know that this is the way I want to live.
My fear was that it would be something that wouldn't be diagnosed properly and would wind up killing her.
Amanda soon becomes consumed with finding out what's been wreaking havoc on her body. After seeing a variety of specialists and getting nowhere, she decides maybe it's time to find out more about fibromyalgia.
Well, I was getting fed up, and that's when we decided to contact one of the fibromyalgia and fatigue centers around town.
Amanda tracks down a clinic in her area, and 1 week later, she and Ira go to meet yet another doctor.
We went to see this doctor. He said the magic words, what you say is legitimate, and I will treat you, and I will help find out what is wrong with you. And that felt so good. Here was someone willing to listen to me.
As he begins performing a head-to-toe examination, Amanda is hopeful that finally someone will be able to help her.
He says that I don't exhibit all of the pain points that someone with fibromyalgia would, that he does think it is something else, and he took 30 vials of blood and tested me for everything under the sun.
He's confident that when the wide array of test results come in, he'll be able to pinpoint just what's been triggering the chronic symptoms. In the meantime, the doctor directs her to take a daily regimen of 51 pills to help control her fatigue and pain.
I thought that the 51 pills was incredibly excessive, both prescription and herbal supplements, and I didn't know what that was going to do to my body. I was worried, okay, am I going to die from taking 51 pills?
It seemed a lot to me at the time, but if it helped her any, that was fine with me.
None of those medications or treatments or blood tests were covered by the insurance. We spent tens of thousands of dollars on that treatment.
If anything could make me feel better and make me get off that couch and just spend more time with my family, I would do it. I was so desperate.
Amanda Kover has been suffering from debilitating head and knee pain and dry skin and hair for 2 years, and every doctor she's seen has found nothing physically wrong with her. Desperate for answers, she meets with a fibromyalgia specialist who orders a battery of blood tests and puts her on 51 pills a day to help with her symptoms.
I did seem to have a little more energy, but it didn't help with the pain, and I didn't feel better at all. I kept on, though, because he said it could take some time.
3 weeks later, the test results come back. But unfortunately, they don't reveal anything significant, and Amanda and Ira are crushed.
The blood work ruled out a lot of things, but nothing was ever diagnosed from those blood results.
While the test results are inconclusive, the doctor assures Amanda that if she continues to take the pills, she will eventually feel better. And sure enough, 5 months later, Amanda is overwhelmed by a shocking new sensation: relief from the pain.
My symptoms disappeared, and I was just ecstatic. And my husband is like, oh my God, here is the woman I married. You haven't even been the same person this whole time, and here you are again, it's nice to see you.
Thrilled to finally feel like her old self, Amanda is hoping that her mysterious illness has gone away for good. But a week later, she's hit by a symptom she's only felt twice before in her life.
The only time in my life I've ever had heartburn was when I was pregnant with my 2 kids. And so I had an old pregnancy test, and it came out positive. And my first reaction was to freak out, because here I was taking 51 pills a day that I didn't even know really what they were.
She comes out of the bedroom crying, and I'm looking at her like, what's wrong? And she says, I'm pregnant.
What am I gonna do? I'm taking all these weird drugs, and what is it gonna do to the baby? And I'm so scared.
I was happy and at the same time very concerned. I didn't want Amanda to have another miscarriage and lose another baby. We made an appointment to go see the reproductive endocrinologist, and he did his exam, and she was in fact pregnant and doing well.
Amanda breathes a huge sigh of relief and then informs her doctor about all the pills she's been taking. He instructs Amanda to immediately go off all of the medications and supplements. Over the next few months, Amanda is feeling better than she's felt in a very long time, and the baby seems to be healthy as well.
It felt like someone turned on a light switch. I went from this pathetic person laying on a couch in pain all day to just myself again. And I felt just so much energy. And I knew that that's how I was supposed to feel. That just proved to me, okay, you weren't crazy.
We did all kinds of activities, started eating out more, going to movies. She was completely pain-free.
Amanda is overjoyed that all of her unbearable symptoms have vanished, but wary of what might happen after she has her baby.
In the back of my mind, I was thinking to myself, well, what if it comes back? I can't take it if this comes back.
We began to wonder, how can this be that when you're pregnant, you're healthy, and when you're not pregnant, you're sick? I can't keep you pregnant forever.
In January 2007, Amanda gives birth to a healthy baby boy, Jake. But just as they feared, Amanda's harrowing pains return with a vengeance.
3 months after having the baby, all my symptoms came back. The day that I felt my first ache, I was just crushed. I was like, please, no. It was like a nightmare.
Amanda and Ira are completely devastated. Not only is she struggling to live with the excruciating headaches and knee pains all over again, she's now barely able to take care of their 3 children.
My children would want me to come tuck them in at night, and I could not walk up the stairs to do it. I would struggle to take a few steps, and I'd be like, I am just too tired, and I am in just too much pain to do it. Everything was falling on my husband, and I felt so guilty.
But the Kovlers promise each other that they will not stop looking for answers until someone makes a solid diagnosis. They begin by setting up appointments with a new set of specialists, including yet another endocrinologist in the area, Dr. Vivian Rodriguez.
Amanda came to visit with her husband, and obviously there was a lot of frustration, anxiety.
Amanda started to tell Dr. Rodriguez everything that had gone on and everyone we had seen and what had happened with all of her symptoms resolving during the pregnancy.
Amanda also hands over her extensive case file that she's been keeping diligently for more than 2 years.
On the laboratory profile, her chemistry was completely normal, but on her thyroid profile, she was having some abnormalities.
When Dr. Rodriguez asked Amanda if she knew that her thyroid levels were wrong, Amanda said that she had noticed that some of the numbers were different, but that she didn't know what it meant. No other doctor really paid much attention to it.
When I found out I was pregnant and I went to the reproductive endocrinologist, he ran some labs on me, and it showed that my thyroid was low. And when I brought that to my OB and I showed him that, he's like, oh, don't worry about it. A woman's body pretty much will naturally adjust the thyroid to meet the pregnancy needs.
This was really pretty much our last shot. We had seen just about everybody else. We had had every blood test done. So if Dr. Rodriguez wasn't going to be able to help us, then we really didn't think there was anything left to do.
Amanda Kovler has been suffering from a series of agonizing and mysterious symptoms, and doctor after doctor has repeatedly dismissed them. But now, 3 years after her first symptoms set in, one doctor, endocrinologist Vivian Rodriguez, suspects she knows what's been causing Amanda so much anguish.
She had dry skin, dry hair. On her neck, felt enlarged. The right side was a little bit more prominent compared to her left side on her thyroid. And then when we check on her muscles, there was a decrease in terms of the muscle relaxation time. And that's one of the markers that we look for the situation of thyroid diseases.
After going over Amanda's medical history with a fine-tooth comb and giving her a thorough examination, Dr. Rodriguez is confident she has the answer the Kovlers have been so desperately looking for.
After evaluating Amanda and having the interview and reviewing her laboratories and her exam, I was convinced that her diagnosis was Hashimoto thyroiditis.
Hashimoto's disease is an autoimmune disorder in which your immune system produces antibodies that attack your thyroid gland, a butterfly-shaped gland located at the base of your neck. In a healthy individual, this gland produces hormones that help regulate many of the body's activities, from muscle function to metabolism to reproduction. But in patients like Amanda, the attacking antibodies gradually destroy the thyroid gland, making it almost impossible to produce the hormones the body needs.
Knowing that the thyroid hormones are going to work in all the different systems in your body, not having the right levels on your thyroid, it will basically affect every single function.
Ira and Amanda are overwhelmed by everything they're hearing. Finally, it's all beginning to make sense.
I was like dumbfounded because, number one, these are the same labs I had showed so many other doctors. Number two, she hadn't even done her own workup, and she came up with this diagnosis for me.
I mean, I began to cry. I felt betrayed by all the other doctors I had trusted with this. And I was so relieved that Dr. Rodriguez had finally spent the time to look at this and see what was wrong with Amanda.
Hashimoto's causes dry skin, dry hair. You can have miscarriages and fertility problems. You have joint pain. You have headache. Everything I had was this disease.
Dr. Rodriguez immediately puts Amanda on a medication that mimics the hormones produced by the thyroid gland to start treating her symptoms. As she begins to feel better, Amanda can't help but wonder why the debilitating disorder seemed to simply disappear when she was pregnant.
During pregnancy, a lot of the hormones are going to be enhanced in order to have better function. It's kind of a protective period in order for you not to destroy the fetus. Then after the delivery is when you lose that kind of protection, and the person will become more symptomatic.
Amanda is elated to finally have a diagnosis, but can't shake her frustration that so many other doctors couldn't put the simple pieces of the puzzle together.
It's not difficult to be diagnosed, but the person needs to make sure to be a detective, putting together the situation of the physical findings, the history on the patient, along with the laboratory findings on the patient.
I think it was tricky because no one wanted to see the big picture. Everyone was so determined to say that it was because I was a mom and overburdened, or because I was a woman and my hormones were off, or because I was depressed.
No one physician ever really referred us to another physician to get further investigation. We went on our own each time seeking help. No one ever said, I don't know the answer, I believe you that something's wrong.
Amanda is very lucky to have finally gotten the answers she needed. Had she continued to go undiagnosed, the already unbearable symptoms would only have intensified.
She will linger with more of these complaints, and it will be getting to be more and more debilitating for her. She could get compromised with her heart, which is one of the most serious situations.
I think that this would have eventually killed her.
Today, just 3 months after being diagnosed, the changes in Amanda's life are remarkable.
Amanda's doing a lot better. Her hair is back to normal. Her skin is good. She still has some pain in her legs and it's getting better. Her energy level is dramatically increased.
The Hashimoto's I will have to manage for the rest of my life. Overall, taking one pill a day sounds pretty good. If I hadn't continuously gone to doctor after doctor after doctor, I may not have my diagnosis today. Advocating for your care is the #1 important thing you can do for your health.
While a slew of bizarre medical issues caused Amanda Kover more than 3 years of anguish, Ann Hummel could never have prepared herself for the series of harrowing and deadly symptoms that seemed to be all in her head. In the summer of 2001, Ann Hummel was a healthy 36-year-old mother of 4 who worked alongside her husband in the sales office of an upscale resort in Orlando, Florida.
We'd work together from about 7:30 till around 2 o'clock, and then we'd just go have some fun and then spend time with the family.
We lived on a lake, so we'd go boating, we'd go to the gym, we'd go rollerblading.
Ann was always in great shape. She always took care of herself, very goal-oriented, just really full of life.
Ann and her family are busy living life to the fullest, until one day in August of that year, when Ann notices that she's not feeling like herself.
I was having headache and sinus pressures.
She had mentioned maybe it was due to an allergy, and Ann, being Ann, very positive, didn't pay that much attention to it.
When she gets home from work, she tries to relieve the pounding in her head with an over-the-counter pain medication. But over the next 3 days, the agonizing headaches don't let up. Concerned, Ann checks in with her primary care doctor.
She pressed on my sinuses, my sinus cavities, and figured that it was a sinus infection.
A sinus infection is a common condition that causes your sinuses and nasal passages to become inflamed, often resulting in headaches and a feeling of excess pressure around the head, nose, eyes, and cheeks. Anne's doctor prescribes a course of antibiotics which she diligently takes, and a few days later, the pain is gone.
I thought it's cleared up now, so hopefully that's it.
But much to Anne's surprise, over the next few months she continues to suffer from frequent headaches and finds herself going back to the doctor over and over again. Each time, her physician is confident that she is just suffering from recurring sinus infections and keeps giving her prescriptions for antibiotics.
Anne got temporary relief for short periods of time, and then the time in between the relief became less frequent, and the rounds of antibiotics had to be increased.
I'm not one to get sick, so it wasn't making sense that suddenly I'm getting sick every couple months. It was very worrisome to me.
Then, in the spring of 2002, the excruciating headaches return yet again, but this time they are worse than ever.
It's probably the third week of March, and I get a sinus infection, but this one seems different. It is intensely painful, the headache is, and I'm taking over-the-counter pain medicine constantly now, up to about 8 a day.
As someone that has a sinus problem, I used to get headaches, but nothing like she described. The headaches were just so severe.
Anne checks in with her doctor again and is given yet another course of antibiotics. But like every time in the past, they don't help for very long. In fact, Anne is feeling worse than she's ever felt before and is beginning to wonder if something far more serious has seized control of her body.
I kept expecting them to give me the right antibiotic or just to figure out what was wrong with me, and I was beginning to feel completely hopeless and that nobody was ever going to figure it out.
"36-year-old Anne Hummel has been suffering from a series of relentless headaches and agonizing sinus infections for more than 6 months.
The headaches were so bad that before I even opened my eyes in the morning, I felt the pain.
Despite multiple visits to the family doctor, Anne's crippling symptoms have not improved. In fact, they have intensified.
I would have over-the-counter pain medicine right by my bed, and I would have 3 to 4 of them before I would even start my day.
We always did things after work, and she wasn't able to do the things that she enjoyed, so all of a sudden not to have your friend go with you to the things that we were so used to doing on a daily basis and to see her suffering, it was very frustrating for all of us.
Almost like clockwork now, she checks back in with her doctor. But this time, much to Anne's relief, she is sent for a CAT scan of her sinuses and is hopeful that the results will finally reveal some clue as to what's been triggering the debilitating symptoms.
I had to wait probably a week to get the results back, so the whole time I'm in awful pain, and I'm up to probably about 12 over-the-counter pain medicines a day. And they finally call me and tell me, well, we know the source of all your pain. You have maxillary sinusitis.
Maxillary sinusitis is a type of infection that affects the sinuses behind your cheekbones and causes intense pain. Her primary care physician immediately refers Anne to an ear, nose, and throat specialist for further consultation. While she's thankful to finally have some answer, she's exasperated when she finds out that she's going to have to wait 2 weeks for the next available appointment.
She was deteriorating so rapidly, I didn't think she could function for a short period of time unless we got some type of answers quickly and some type of solution very, very fast.
Anne does her best to grin and bear it, but a week later, she reaches her breaking point.
I was at work one day, and I called the doctor's office, and I said, this cannot be maxillary sinusitis. I cannot handle this pain. She said, well, you're just going to have to wait for your doctor's appointment because I cannot do anything more.
Overwhelmed by the pain, Anne unexpectedly discovers one way to temporarily ease her agony.
I would just take a chair, and I would just tilt it back as far as it would go on its legs and put my head back against the wall. And somehow that would help alleviate the pain some.
Now, as awkward as it may seem, Anne is spending all of her free time in this position as she counts down the days to her appointment with the ear, nose, and throat specialist. Then, without any warning, a strange new symptom emerges.
I remember noticing a fluid coming out of my left nostril, and it was just dampness that was always there.
She was always wiping her nostril. She was kind of embarrassed because obviously she would have to meet with clients.
Armed with a purse full of tissues, Anne manages as best she can, but it isn't long before yet another strange symptom begins to develop.
I also noticed a kind of a metallic type taste in my mouth. It would be as if you had eaten something for breakfast or lunch that had left a bad taste in your mouth. I just could not get rid of it.
She hated that. She would constantly want to brush her teeth or do something to get the taste out of her mouth.
We would buy packs and packs and packs of gum. So she was constantly chewing gum.
Anne assumes everything she's experiencing is related to her sinuses draining, but each passing day is becoming harder and harder to get through.
I hadn't given up to the point that I was going to stay in bed all day. To me, that would be just like, admitting defeat. So I would just try to save my energy to be able to go in and work. If I could just make it from 7:30 to 1 o'clock, then I could go home and lay down.
I would take care of things because obviously she was in too much pain to deal with it. And I'd get the kids up, get them to school, work, come home, take care of the house.
My kids were not coping very well with seeing me sick and laying down all the time. At this point, they would have to see me in bed. If I was not at work, I was in bed.
It was very hard to watch the children not able to really communicate with their mom because she was in bed. We had to be very sensitive every time we walked in that room, how to approach her, how to talk to her, and how to even sit on the bed because the headaches were so severe.
You don't know what to do. You feel at the mercy of God to do something.
Then, just 2 days before her long-awaited doctor's appointment, while she's meeting with clients at work, something completely unexpected happens.
I was with the husband and wife sitting at the table, and I got up to go get their paperwork. I was like, oh my gosh, I couldn't even read the paper. And I started to walk back to my table, and I couldn't even remember where I was sitting.
Frightened by the abrupt change in her vision and her disorientation, Anne excuses herself. Moments later, she begins to feel like she's going to faint and immediately tells her boss that she needs to leave, now.
He said, what's wrong with you? And I said, I'm really sick, I have to go. He said, you can't drive. I said, I'm going.
Terrified, Anne rushes to her car and calls Tom.
She said, I'm in such pain and I can't see to drive.
Tom said that he was going to call an ambulance. And I told him no, that I needed to just go home and lay down and I was going to be fine. And he said I needed to go to the hospital right now.
As Anne's vision sharpens a bit, she gives in, but insists on driving herself to her doctor's office.
It was amazing she could even drive. She had slurred speech. She couldn't walk unassisted. So I walked her in to see her primary care once again.
And she again determined that I had maxillary sinusitis and that, my appointment was only in a day or two now with the ENT and that probably I should just go home and rest and wait for that.
Tom and Anne return home frustrated beyond belief. Now they can only hope that the specialist will be able to tell them exactly what's causing the mysterious symptoms.
It was like there was a fire burning in your head. My balance was starting to go. I couldn't even go to the bathroom without Tom helping me. I didn't know what was happening. I was scared at that point.
The next morning, Anne is so weak that Tom has to get her dressed to go to the appointment with the ear, nose, and throat specialist. And almost as soon as he sets eyes on Anne, the doctor knows that something is very wrong.
He had me try to stand up and close my eyes, which of course I couldn't even stand up without help. So standing up and closing my eyes was completely out of the question. I fell over.
Within a matter of minutes, he said, this is not sinusitis. This is a neurological problem, and you need an MRI, stat.
The doctor immediately sends Anne for an MRI of her brain. A few hours later, the couple heads home, hopeful that finally this doctor will be able to solve Anne's case once and for all. Then they get the call they've been so anxiously waiting for.
He said there was nothing wrong. I knew that I was really sick, but I just didn't know what it was. I thought for sure I was going to die.
Ann Hummel has been enduring a series of chronic and extremely debilitating headaches that are now accompanied by a runny nose and a bizarre metallic taste in her mouth. But 7 months after the headaches first started, a brain MRI has revealed nothing out of the ordinary.
I didn't know what to think anymore. I knew for one thing that it was not maxillary sinusitis. I just didn't know how we were going to get the answer to what it was.
Now Ann seems to be deteriorating at a breakneck speed, and Tom isn't sure he can take care of his wife on his own.
She's lying in bed and looked at me and said she needed to go to the bathroom, and when she sat up, she just passed out. So I determined, within about a millisecond, I got to get her to the hospital.
Frantic, Tom carries Ann to the car and drives as fast as he can to the hospital.
I guess I had been unconscious. I don't know. He took me into the doctor's office, I know that, and I guess he had tried to put me into a chair, and I fell onto the floor and passed out.
Immediately, an emergency room team springs into action, taking Ann's vital signs. Once they've stabilized her, she is sent in for a spinal tap, a common procedure performed when a patient has incessant, unexplained headaches.
I think I'm pretty much going in and out of consciousness at that point. I remember the needle's pretty big. You try to go to another place.
3 hours after the procedure, Ann is completely drained by everything she's been through, and she's barely able to talk to the next doctor that comes in to check on her, neurologist Bennett Rosenthal.
I was asked to see Ann in the hospital. It was a routine consultation for headache.
Dr. Rosenthal begins by asking Ann for very specific details about everything she's experienced over the past 7 months. Then he performs a few basic neurological tests to help him begin piecing together her perplexing symptoms.
The first thing that was suspicious was that her headache was worse when she sat up or stood up, and significantly better when she was laying down flat. And her complaints of watery leakage and a metallic taste suggested, well, maybe this is not really a sinus infection, but something else going on.
As soon as Dr. Rosenthal reviews the results of Ann's spinal tap, he knows he's onto something.
When the spinal tap was done, they measured the pressure of the spinal fluid that we call the opening pressure. And the opening pressure normally ranges between 15 to 20 centimeters. Hers was 1.
And when Tom insists that Dr. Rosenthal review Ann's initial MRI that seemed to be normal, he scrutinizes every last detail.
When I looked at Ann's MRI, I saw that she had very small ventricles, the openings in the very center of the brain that contain spinal fluid. For her age, that was a small size and not what I expected to see.
He said that this was very unusual. There was no fluid in the ventricles. Whatever my body was producing constantly was just leaking out.
Based on all the information that we had available, it could be determined that Ann had a cerebrospinal fluid leak.
A cerebral spinal fluid leak, or CSF leak, happens when the fluid surrounding the brain and spinal cord leaks. This fluid plays a crucial role in the body because it cushions and protects the brain and spinal cord from both trauma and infection. When there's a decrease in fluid, the nerves in the brain can end up pushing directly against the skull, causing severe pain. In most cases, a CSF leak occurs after a head, brain, or spinal injury, but in some patients, like Ann, doctors believe that the leak happens spontaneously, without any obvious cause.
I had never heard of this type of leak before, and it was kind of scary, but at least he knew what was causing my problem, and it was not a sinus infection.
While the Hummels are relieved to finally have an answer, they're stunned by just how dire the diagnosis really is.
If there's a leak there, there's an opening and bacteria can invade the spinal fluid area. If bacteria invade the spinal fluid, you can get bacterial meningitis, which is a potentially fatal condition.
With no time to lose, Dr. Rosenthal immediately starts Ann on medications that will hopefully repair the leak. But within a few days, it's clear that the prescription isn't working.
It just wouldn't heal on its own, and at the same time, my vital signs were just getting worse and worse and worse.
At that point, her care pretty much was transferred out of my hands and into the neurosurgical and ear, nose, and throat doctors for them to help evaluate where the source of the CSF leak was.
Just 2 weeks after her diagnosis, the surgeons lay out Anne's only remaining option, a risky exploratory operation on her brain that will hopefully determine exactly where the leak is.
I was not doing well at all. I'm usually strong enough to make it through anything, but my body had just felt like it had been through a war. And I just didn't know that I was going to be able to make it through that surgery.
As Anne is wheeled into the OR, her family anxiously stands by, knowing all too well that the odds are not in her favor.
That was nerve-wracking, very, very nerve-wracking. You're really at a loss because you feel very helpless, and hope is everything. And sometimes it's the only thing.
2 hours into the arduous operation, the team finally zeroes in on the problem, a pinhole-sized opening behind her nose where the spinal fluid is escaping. The only way to close the hole is to glue a patch over it in the hope that it will stop the potentially life-threatening leak.
I woke up and my husband was there and my mom was there, and the doctor was so excited. He said he found the leak and he was able to patch it. That was good news.
But their celebration is short-lived.
The patch lasted for about 6 weeks, and then the patch started leaking again. I tasted CSF fluid in my mouth, and now I knew what that metallic taste was.
Little do the Hummels realize that this is just the beginning of what will become a series of 17 potentially fatal operations.
There were a few times that she was convinced she wouldn't wake up, and I'd always say, stay away from the damn light.
My greatest fear is that I was going to say goodbye to my friend, and that was probably the hardest thing I ever went through.
The doctor at the end is like, we have no idea why she's alive. She should have been gone a long time ago.
Then, after more than a dozen failed attempts, one patch finally seems to do the trick. The Hummels and Dr. Rosenthal breathe an enormous sigh of relief.
I think Anne's prognosis is very good. Anne has had a very positive attitude towards a potentially disabling condition. She could very easily be laying in bed the rest of her life, but instead she's fought this and dealt with it and is actually doing quite well.
While they're grateful that Anne has been successfully diagnosed and treated, the Hummels still have difficulty understanding why it took so long for anyone to solve the mystery.
A CSF leak can easily be mistaken for another problem. It's certainly much more common to have the common cold or sinusitis.
When someone comes in with what seems to be an easy diagnosis, that's the first path that everyone takes.
A lot of times we'll treat headache types like sinus infections, trying a treatment approach very quickly without careful listening, and in her case, the listening to her history is really what made the difference.
Today, 5 years since she was diagnosed, Anne's still adjusting to a slower lifestyle. She will always need to keep a close eye on the patch, as there is no guarantee that it will always work.
My patch pretty much holds. It only leaks maybe once a year now. It still leaks whenever the pressure gets too high. I can't fly in an airplane anymore. I can't go up in the mountains. So we just avoid those things, and we seem to do well with it.
She's learned how to deal with the illness. She's very in tune to her body.
Anne still suffers from occasional headaches, but they're not nearly as severe as the ones she had before the patch was put in place.
To look and talk to Anne, you would never think she went through 17 brain-related surgeries and is dealing with a life-threatening thing every day. And to cut is not to cure as far as Anne is concerned, and she says she'll never go back under the knife again. And she lives life to her fullest.
Every day is precious, because you just don't know when you're going to be around.